Hi, everyone, and welcome to this edition of Talk with the Expert, a space created by the association Salvando Latidos, where each month we discuss a topic of interest in cardiology. And in May, we'll be talking about heart failure. And today's discussion will focus on the perspective of Marc Bains, who not only lived with heart failure, but also has experienced first-hand the challenges of living with this condition. And he founded HeartLife Foundation to help hundreds of people facing the same journey here in Canada. So thank you for being here. How are you, Marc?
I'm doing very well. Thank you so much for having me. I'm so grateful for the opportunity to share my story, a little bit about what we do with HeartLife, and think about ways we can work together to support patients and caregivers, across the world.
Oh, thank you, really, for being here. So, Marc, let's start it. So, I know you were diagnosed with heart failure at a very young age. So, can you share your journey as a patient and how you navigated the physical and emotional challenges of this condition, specifically heart failure?
Yeah, no, for sure. And thank you for the question. Sharing my story. Geez, I was diagnosed at the age of 23. This was back in 2008. So if you quickly do the math, I turned 40 April 17th, so a few weeks ago, which is fantastic. So I was diagnosed at a young age, all things considering. Generally at 23, the last thing you think about is heart failure.
Yeah.
I thought I had a cold. Honestly, it was a cold. Something I've had before. The cold then turned into the flu. Still, like a lot of people, I go to the doctor, my family doctor. I'm lucky to have one. And I said, yeah, I think I have the flu. He said, maybe it's bronchitis, maybe it's your childhood asthma coming back. And I said, okay. I mean, yeah, you listen to your doctor as we're taught to do as we grow up. Doctor says you're sick, so you listen, you take medication, you get better. Unfortunately, over the few weeks after I saw my doctor, I got worse. It got to a point where I couldn't walk up my stairs without being short of breath, which was unusual. If I made it upstairs, I couldn't lie down flat because I was coughing. At the time, I thought I was bloated. Maybe I had a little bit of swelling. Again, I didn't think heart failure because if I put it into perspective, prior to feeling sick, I had just started my first career. I was 6 months in. Prior to that, I had traveled around the world for 6 months, 6.5 months. Just before that, I had graduated university. So at 23, I was entering, I call it the adult stage of my life. So having this cold, having this flu, normal, yeah, but having these additional symptoms were not. When I had the chest pains, that's when I decided to get a second opinion. So I went into the emergency department. After just about 4 hours or so, some tests that I've had before, X-ray blood work, we have those, but some I haven't, like electrocardiogram, so an ECG, or an echocardiogram, which is like an ultrasound of my heart. The emergency physician came back into the room with a very concerned look on his face, and he said, "Marc, you have dilated cardiomyopathy, heart failure." And I was in shock.
Yeah.
Again,
What was your first reaction to that diagnosis?
my first reaction and first question was, "Am I going to die?"
That's
Because
hard.
yeah, the words heart and failure again were never used in the same sentence. I was 23. I was active. I was in my career.
You
I
never
never
get sick
expected this.
before.
Never. No. Yeah. Exactly. And so it was a shock, not only to me, but to my parents as well, who were there, my family, my friends. No one expected this because there was no history at all either in the family. So yeah, it was scary. And he said that my ejection fraction was between 5 to 10%. So my heart was pumping between 5 to 10% of what it should be pumping, which, as we know, is not good.
Nothing,
So
yeah.
yeah, it was definitely a shocking, scary experience, emotional experience because I didn't know anyone else with heart failure. This was new to me. It was new to a lot of people that I knew. So aside from just the physical challenges that I was facing at the time, you go through this mental and emotional journey as well that is most often overlooked, when it comes to cardiovascular diseases or any kind of major physical
Of
diseases as
course.
well.
Yeah.
And that began my journey with heart failure. I would like to say that after my diagnosis, I got better. I was transferred to another hospital, which had a cardiovascular center. I was there for 3 weeks. I was put on optimal therapy, released from hospital, but then I was back in the hospital within 29 days. Then I had irregular heartbeats, so arrhythmias, and I was put on the transplant list for the first time with worsening heart failure, if you can imagine that.
Yeah.
And that was also a surprise to me because I thought, I would after the first time I would be out, be on medication, I'd be okay. That wasn't the case. That it was going to take a lot more work to get to where I wanted to be, to live the quality of life that I deserved. And so really my start was a false start, and then I started again with my heart failure journey in October of 2008.
And you told us that you live in Canada. So we know that every healthcare system has his strengths and areas for improvement, no? But however, based on your experience as a patient, what would you see as the main challenge in diagnosing and treating heart failure within the Canadian healthcare system? Because we know that in Mexico it's kind of rough, but we don't know
Yeah.
in other countries what will be.
Yeah, it's a really good question, and we think a lot about this. Just I think a lot about it as a patient, but also think a lot about it with HeartLife as well, and how we can change the way care is delivered. And Canada's healthcare system is super grateful for it. I mean, in terms of the care I received, right? Having a public system where a majority of your hospital stays, emergency stays, medications, and you have coverage is so beneficial. We see different healthcare systems around the world that don't offer this, right? So we have access to specialists, we have
Yeah.
access to GPs, we have access to pharmacists, and we have coverage. To that extent, if you're in the hospital, yes, we have a universal healthcare system because you can get the tests you need, you can get the medications or therapies, procedures, surgeries that you need, no problem. Where there's a challenge for Canada is in the community. So where you live, your postal code, your ethnic background, your education, your sex, all that has an impact, your economic status, all that has an impact on the care you receive in the community. So again, while we have this universal healthcare system while you're in the hospital and we have a lot of benefit in the community, there's still a lot of differences in terms of how care is delivered to metropolitan areas versus rural
Yeah.
and remote versus indigenous communities. And so that's one of the biggest challenges. The other part is a challenge in delayed or misdiagnosis. As I told you, I went to the doctor and they thought it was a cold. They thought it was the flu, bronchitis, asthma. No one really thought heart failure because, as a GP or general practitioner, you're expected to know a lot about a lot of
Yeah.
things. And so sometimes you don't have those initial thoughts or understand the signs and symptoms of a chronic disease like heart failure. So we have those missed or delayed diagnoses. And it's particularly challenging in women who, when they have heart failure, it's often attributed to anxiety or menopause or stress or lack of activity, all these
Yeah.
things that it's not, right? But that's where it goes. So I think there's still a lot of work to do in terms of education, awareness, and early diagnosis for heart failure in this country.
And about that, you
Yeah.
started Hard Life in 2016, right? 8 years
Yeah.
after your diagnosis. And what was the turning point that led you to create this foundation? And what goals did you set for it? Because you have an incredible work with this foundation, but where is the point that you started? That you see that you have to do something about it?
Yeah. And it's and thinking back, yes, the foundation started in 2016. It was co-founded by myself, another patient partner who went through heart failure and heart transplant, Dr. Jillian Code, who continues to inspire me every single day with her work, with fighting through adversity, getting to where she is. Yeah, but both of us were advocating before we met. So I started advocating in 2008. So I think that my advocacy journey started with my heart failure journey. When I was in the hospital the second time, I was put on the transplant list. I was taken off it the following April. But at that time, I was going through very, I would say substantial emotional and physical challenges. So I had arrhythmias. I had an ICD implanted, so a cardio defibrillator in my chest. I was getting these irregular heartbeats. They said if you have to go on the transplant list, if you don't get a new heart by April, we might have to put a left ventricular assist device in you, which is a heart pump. And I remember clearly one day, it was October, so it was late October, Vancouver, dark, rainy. St. Paul's is an older hospital. We're building a new one now. I was alone in my room, and I was breaking down because I didn't know what to do. A nurse came into the room, sat with me for a few hours. I don't know how long. We just chatted for a while. And the next day, my cardiologist asked me if I wanted to meet two individuals that had lived with heart failure. One had a left ventricular assist device, the other had gone through transplant. So I said, sure. I mean, there's no harm. I can't lose nothing. Great to meet them. So I met these two guys, and it really changed the way I thought about heart failure. It changed my trajectory completely. I realized that they were living the quality of life that they wanted to live. That heart failure didn't have to define me. That with the right tools, resources, and support, I could live the quality of life I wanted to live. So that changed my trajectory of heart failure. Again, I was taken off the transplant list April 2009, but I also started advocating within the community, within the province. So I got involved with Cardiac Services BC, reviewing educational materials for patients. Then it got to a level where I was contributing to the development of educational materials, and now to a point where I sit on the board of Cardiac Services BC Heart Failure Committee as a patient partner. And so my advocacy evolved, and then in 2016 had the opportunity to attend a national roundtable on heart failure. It was really the first time that Canadians were talking about heart failure in a coordinated way. I mean, traditionally our healthcare still operates in silos, so it's provincially mandated, but we had people from all provinces. We had healthcare professionals, we had industry partners, we had policymakers, we had some of the societies, Canadian Cardiovascular Society, Canadian Heart Failure Society, and then two patient partners,
Yeah, you
myself
were
and
the only
Jillian.
one patient, right? There.
There's yeah, so it was myself and Jillian. It was just two of us, and we remember clearly. There is a stat on the screen that came up. There's 650,000 Canadians living with heart failure. That was 2016. Now that number is closer to 800,000 with 100,000 new diagnoses every year. And we both looked at each other and we said, why are we the only two
Patient.
patients at the table?
Yeah.
Where are other people getting support? And the answer was nowhere, unfortunately, in the community. There was no mechanism for support for people living with heart failure. So we said, let's start something. So we went into the hotel lobby that evening. We started the HeartLife Foundation, and really it was just a mechanism for support. It was a Facebook group. Over the next few months, we registered as a national charity, and then evolved from a support group to an organization that engages, educates, and empowers people living with cardiovascular disease, patients and caregivers, so they can live the quality of life they deserve. And that's how HeartLife started, and that continues to be our mandate now.
Yeah, that's truly inspiring because you started something that it could be like the worst part of your life, and you just convert it as something like just inspiring support a lot of people around not only Canada, also the world, in doing something and being more like a community, as you said. So
Yeah,
I know that education and support for heart failure patients are the key aspects of your foundation, right?
they
But
are.
what do you say that are the biggest needs for patients, and how does HeartLife work to address them right now as a foundation that is just assist?
Yeah, that's a good question. One of the things that we did early on, Jillian and I, when we started HeartLife, was a patient journey map experience. We were both diagnosed in a metropolitan area, so we were both in Vancouver. Jillian, Vancouver, Victoria. But we had major heart centers around us. We had support mechanisms around us. Our cardiologist was Dr. Sean Varani. He's now the president of the Canadian Cardiovascular Society.
Yeah.
So, we had the right teams. But what we realized real quick was that we were the exception and not the rule. That not everyone got the care that we got. I mean, alluding to my point earlier about care in Canada and universal healthcare, not everyone was in the same shoes that we were in. And so we decided over a year and a half to do a patient journey mapping experience where we worked with almost 200 patients, caregivers, healthcare providers to understand the heart failure journey from pre-diagnosis, so what led people to diagnosis, that diagnosis stage of heart failure, living with heart failure, and then going into advanced heart failure care. From that, we were able to understand the needs and challenges of people living with heart failure and then the opportunities. Some of the biggest needs we saw came on that diagnosis side. I mean, understanding signs and symptoms, that early diagnosis that everyone deserves to receive an accurate and timely diagnosis of Canada, and that's a gap in this country. That when people are in the hospital and then discharged, that they want more education, that they need support in the community because once they leave the hospital, they feel lost. All the
Yeah.
education that they get in the hospital is overwhelming, right? It's so much information. You're just diagnosed with something. You're taking all these medications. They're trying to tell you how to manage your life, completely change things. And they just, kind of goes in one ear, out the other. From that respect, and there's a huge need for mental health support as well. Again, to my earlier point, you often overlook the physical challenges of heart. You see the physical challenge, but often overlook the mental,
Emotional.
emotional
Yeah.
aspects about it. So how do we bring that into the community? I mean, I think the number is around, it's above 80% for sure of heart failure care happens in the community. But in the community, there's a lack of support and resources from an engagement perspective, from an education perspective. So that's where HeartLife tries to come in, and we build tools and resources like HeartLife Academy, our toolkits, our passports. We do webinars. We have those support groups to then support those individuals in the community where they are.
And about that community, all those years that you have this foundation, until now, what's your perspective on heart failure globally? And do patients and caregivers have the same needs? And if not, what are the opportunities to improve care? I mean, in Canada.
Yeah, that's a good question. I'm fortunate that we do a lot of global work as well. So we do global work with the Global Heart Hub, which has been
Yeah.
an amazing organization that that has created this network of cardiovascular patient organizations around the world to learn from, to network with, to grow with. So I have a unique perspective. I also sit on a lot of global advisories and do a lot of global work with industry partners, again, across the world. So I'm able to have a better understanding on perspectives. And, you'd be surprised, maybe not, that a lot of the needs are the same.
Yeah. Most
There's a
of it,
lack of,
they are all the same. Yeah.
yeah, yeah, exactly. There's a lack of awareness of signs and symptoms of heart failure. So, diagnosis is a challenge. And then that care in the community is a challenge again. When people leave their community, whether it be in the US, Mexico, or Europe or Asia, they don't have the support they need from an education standpoint, from a peer-to-peer support mechanism, or even from a general practitioner perspective. And that really hinders their ability to live the quality of life they deserve. And so I think that a lot of those challenges are universal when it comes to heart failure. And that's why it takes the collective to work together to create some universal messaging as well.
And do you think one of the needs that is just misunderstanding is the psychological needs? And what would you do about that in Canada? You have this support for different organizations, or you have to do something about it, not only about the physicians, about the reference that they have, what you do with a patient as a doctor or as a general practitioner, or you have a specific way to do with the patient to go with that kind of support. I mean, emotionally is a huge impact. And what would you do about that?
Yeah, it's definitely a challenge. I was on a call earlier today with the group at a St. Paul's hospital, our local hospital. We had implemented a peer-to-peer mentorship program for
Oh,
people
perfect.
living with left ventricular assist device and transplant. And this is where the support comes in. So, everyone that is diagnosed with heart failure and their caregiver, because caregivers are along for the journey,
Yeah.
should be asked that at the very least if they want support for their mental health and be referred. We did a survey early on in our Facebook group where we said how many people here were offered mental health support upon diagnosis. And over 85%, I think it was, said no, they weren't offered support. Then we asked the follow-up question, how many people would have liked support? And that number was over 95%. They would have taken the support they need. So I think part of every care journey, you need to have this multidisciplinary team that includes not only your heart failure specialist, your nurses, your general practitioner, your cardiac rehab specialist, but also mental health support and other patient partners and caregivers who can help guide you along the way. And I think that's a universal need for everyone living with heart failure.
And another need that is also left behind is the rehabilitation after the diagnosis and all the treatment that you have to pass. You have a heart transplant, right? And
Yeah.
that's, well, in Mexico, it's kind of hard have a heart transplant or every kind of transplant. But what would you say that is in Canada, how about this rehabilitation and the activities after you diagnose it, and how is take as a treatment, the rehabilitation and all this physical therapy?
I would like to say that we have a great program for cardiac rehabilitation, but we don't. We regularly advocate it. You know, the access is the biggest problem. You have so many diagnoses of heart failure, and you know the other challenge is in heart failure you go through ups and downs, right? So
Yeah,
sometimes you might be great for months, for years, other times not so well, where you need cardiac rehab once again potentially, or an event happens and you go into cardiac arrest and you need to get back on your feet. So there's a lack of resources for cardiac rehab across the country. It's a few things. One, limited centers, which means if you're living in rural and remote areas, how do you get support for cardiac rehab? You have to travel 3 hours, 6 hours, 8 hours to get it. I mean, no one wants to do that.
yeah,
It's
no,
cost prohibitive. So sometimes you have to pay for cardiac rehab. What if you can't afford it? What do? Do you decide to pay rent or do you decide to go to cardiac rehab? Right. So there's those challenges. There are some community programs that have taken on cardiac rehab as well, which is helpful, like the YMCA. But I think there's a lot of opportunity, whether that's in person or through digital health as well, where you can do online programs and really get out to the masses and be able to support communities in rural and remote areas or at-risk populations, whatever it may be, with cardiac rehab programs and with that nutrition, education, and diet and all of the above.
yeah. For me, that's shocking because I would expect that you have less problems than us just for that kind of I don't know, rehabilitation or some programs that you have, but we have almost the same issues about having the integrative therapy that you need as a patient, right? And
Yeah,
as a caregiver.
yeah,
Yeah.
yeah.
Well, finally, for the final question, for those who are just beginning their journey, that is, it's kind of difficult, what advice would you give based on your personal experience and the work that you have done with HeartLife?
That's a good question. Yeah, it's and I have to stick to my advice because we're recording this. Yeah, everyone that's diagnosed, they should know that they're not alone in this journey. That there's a community around you. There are people just like you who went through the things that you're going through, that have gone through the things that you're going to go through. And I go back to when I was diagnosed and I met those individuals with heart failure. Heart failure doesn't have to define who you are. It's not the end of your life. That
Yeah.
with the right tools, with the right support, and there's support groups out there, with HeartLife has one online, with the right resources, people can live the quality of life they deserve, albeit a little bit different, but you can live the quality of life you deserve. With heart failure, not all is lost, and that it's about life, not failure.
Yeah, that's the slogan of HeartLife Foundation. So, I mean, this is just the way that it should be.
Yeah, I think so. I hope so.
Well, Marc, really, thank you for this talk with the expert. It has been really an incredible conversation. And of course, behalf of Salvando Latidos Association, we will be always grateful for you to accepting this invitation to speak about something as big and as important for us as is for you, as is heart failure. And I want to add that your courage in sharing your experiences is truly inspiring for us and for everyone who is listening this. And we also thrilled to collaborate with HeartLife in supporting more people living with this condition. That is that a condition and you can live with that.
Yeah.
So Thank you really for being here and for sharing all this. Thank you really for who are listening this for the first time. And just, I wanted to add, this is not something that you have to take so hard and so afraid. Something like heart failure has a lot of therapies and you have a lot of ways to do about it. And every single person is different, but heart failure has treatment. So you just look for it. And there are a lot of associations as heart failure, as Salvando Latidos, another association and a group of people and institutions that just do something about you. So thank you for being here, Marc. Is anything that you want to add finally at this talk with the expert?
You know, after our first meeting, you inspired me to go back to our resources, and we've now translated everything into Spanish. It's not publicly available yet, but I'll share it with you when it's ready. And you know, all of our HeartLife Academy videos as well. You know, I think collaborations like this are so important, and I look forward to working with the organization more and finding ways to support patients everywhere we are.
Oh, thank you. Really, thank you. And for the people who are listening this talk with the expert, thank you for your support, and see you the next month with another topic about what is heart and what is living with heart conditions. So thank you and have a great day.
Thank you. Bye-bye.